In type 1 diabetes, the immune system attacks insulin-secreting beta cells, destroying the body's ability to make insulin and clear out blood sugar. But this doesn't happen overnight. It's a long process to get to this clinical diabetes. And if researchers can find a way to stop the autoimmunity before beta cells vanish, they might be halfway to a cure.
Diabetes can be thought of as a spectrum, and what we think of as clinical diabetes is only at the very end part of that spectrum, when you've lost so much insulin-producing capacity that you can't keep your blood sugars in check. But earlier on in the process, things such as autoantibodies develop.
TrialNet, an international network of type 1 diabetes researchers, uses these autoantibodies to detect who might be at higher risk for developing the disease. Joslin is a TrialNet affiliate. They offer testing to the relatives of people who have already been diagnosed, looking for signs of impending diabetes.
Just because an individual develops autoantibodies doesn't mean that they're necessarily going to go on to progress to developing type 1 diabetes. But once you've gone on to develop 2 or 3 of the autoantibodies, then the risk dramatically shifts, and most of those people within 5 to 10 years will go on to develop clinical type 1 diabetes.
Those who test positive for autoantibodies take further tests to determine other risk factors. Next steps depend on the results. Participants' progression could be tracked within the natural history study, which follows the patient's health with no intervention, or they could qualify for one of a few prevention trials, which attempt to delay or prevent the onset of type 1 diabetes.
So ultimately, we want to cure type 1 diabetes. And to do that, we need to understand as much about the disease as possible. And we also need to do clinical trials to see if we can change the disease course. So TrialNet, under the natural history study, is the largest study in the world in identifying people at risk for development of type 1 diabetes, identifying the most individuals who are autoantibody positive and at the highest risk of developing clinical disease before they have clinical disease.
Any cure would need to be twofold: stop the autoimmunity and replace the lost beta cells.
And it's a lot easier to address the loss of insulin-producing capacity if we caught them a lot earlier. And in fact, if we caught them so early that they didn't yet have clinical diabetes, because then really all we'd have to address is the autoimmunity, because if we stop the autoimmunity at that point, they don't have clinical diabetes.